In general, I support it. It promises to provide access to health care through health insurance for 30 million people who were previously uninsured. So that's a very good thing. Well, the two major shortcomings. One is that even with full implementation of the Act, we'll still have about 20 million people who will be uninsured in the United States. Most of those are people who are in undocumented families. Some of them are people who choose to pay the penalty rather than purchasing health insurance. Some will find health insurance to be unaffordable, even with the subsidies. So at best, we'll be left with about 20 million people who still won't have health insurance. The other major shortcoming is that it doesn't do a lot in itself to hold down the increase in healthcare costs that we see in this country. So there are some things to reduce overpayments in the Medicare program, but in general, it doesn't do a lot to actually make healthcare more affordable. The emphasis is on increasing access and providing more competitive markets where people can buy health insurance. Well, the major impact I've seen is that a lot more people who previously were not able to get Medi-Cal, which is the Medicaid program in California, are now able to get it. So we have a lot of people that we used to see in our free clinics that are affiliated with UC Davis who didn't used to have any kind of access to medications or to tests like x-rays or to surgery when they needed surgery, and they would suffer because of that. But now, if their income is below the threshold for Medi-Cal eligibility, they can get on Medi-Cal and they can get the services they need. So that's been a huge benefit. Well, we're capable of doing anything that we want to do. So we set challenges for ourselves as a country. We meet those challenges.
But do you see it in the future that we will achieve that level?
I think it's an incremental process. We go a step at a time. Everything that we've done in public policy tends to be just incremental, one step at a time. So naturally, I hope that we'll get to a point where everybody in the population will have access to health care. This law in itself won't do that. Maybe it'll take 10 years more, 20 years more. I think eventually we'll get there. Well, another popular myth is that the law will somehow impose some kind of rationing of care. We often hear about the term rationing, but there's nothing in the law that imposes rationing. We've had a system, frankly, over the last several decades that I've been in practice where we have rationing based on people's ability to afford to pay for care. So when people can't afford to pay for a hip replacement, for example, and they don't have insurance, they can't get it. So that rationing based on how much money you have is in fact better under the Affordable Care Act. And there's no new rationing scheme that's been put into place in the Affordable Care Act.